A stroke is often called a brain attack, an emergency that happens suddenly and can change a person's life in a matter of moments. It's a medical crisis that requires immediate attention, just like a heart attack, but it affects the brain, the body's control center. A stroke occurs when blood flow to a part of your brain is suddenly interrupted or completely cut off. This can happen because a blood vessel is blocked by a clot, or because it bursts and causes bleeding in the brain. Without a steady supply of oxygen-rich blood, brain cells begin to die within minutes. The longer the brain is deprived of blood, the more severe and lasting the damage can be. This is why strokes are so dangerous and why every second matters. The brain is responsible for everything you do, moving your arms and legs, speaking, thinking, remembering, and even feeling emotions. It's the command center for your entire body, coordinating every action and reaction. When a stroke strikes, any of these abilities can be lost in an instant. You might suddenly be unable to move, speak, or understand what's happening around you. The effects can be mild or devastating, depending on which part of the brain is affected. Many people think strokes only happen to older adults, but that's not true. Strokes can affect anyone, at any age, even children and young adults. In fact, the number of younger people experiencing strokes is rising. Modern lifestyles, high stress, poor diet, lack of exercise, and conditions like high blood pressure and diabetes have all contributed to an increased risk of stroke in younger generations across the globe. Recognizing the signs of a stroke and acting fast is absolutely critical. Every minute counts. The sooner someone gets medical help, the better their chances of survival and recovery. The effects of a stroke can range from minor weakness or numbness to complete paralysis, loss of speech, memory problems, or even death. Recovery can be a long journey, and some people may need ongoing support and rehabilitation. Knowledge truly is power. Understanding what a stroke is, how to spot the warning signs, and what to do in an emergency can make all the difference. It can save your life, or the life of someone you love. Thanks to advances in medicine and technology, more people are surviving strokes than ever before. But these treatments work best when they're started quickly, so time is of the essence. In this video, we'll break down the different types of strokes, explore their causes, highlight the warning signs you should never ignore, and share practical tips for prevention. Let's get started on understanding strokes and how you can protect yourself and those around you. Your brain is just 2% of your body weight, but uses 20% of your oxygen. It relies on a constant blood supply through arteries, its lifelines. A stroke happens when an artery is blocked by a clot or bursts, cutting off blood flow. Deprived of oxygen, brain cells malfunction and die fast. The symptoms depend on which brain area is affected. Movement, speech, or understanding can suddenly vanish. Time is brain. Every minute without treatment means more brain cells lost. For every minute untreated, nearly 2 million brain cells die. The longer the delay, the worse the damage, and the lower the chance of recovery. Stroke is a true medical emergency. Act immediately. Strokes are medical emergencies that occur when blood flow to the brain is disrupted. There are two main types of stroke: ischemic and hemorrhagic. Understanding the difference between them is crucial for both patients and healthcare providers, as the treatments and outcomes can be very different. Ischemic strokes are by far the most common, making up about 87% of all cases. They happen when an artery supplying blood to the brain becomes blocked, usually by a blood clot. This blockage cuts off oxygen and nutrients, causing brain cells to begin dying within minutes. These clots can form directly in the brain's arteries, which is called a thrombotic stroke, or they can travel from another part of the body, such as the heart, and lodge in a brain artery. This is known as an embolic stroke. Both types can cause sudden symptoms like weakness, confusion, or trouble speaking. Hemorrhagic strokes, on the other hand, are less common but often more severe. They occur when a blood vessel in the brain ruptures, causing bleeding into or around the brain tissue. This bleeding increases pressure inside the skull and can quickly damage brain cells. High blood pressure and aneurysms are common causes of hemorrhagic stroke. In simple terms, ischemic strokes are caused by a blockage, while hemorrhagic strokes are caused by bleeding. Because the underlying problems are so different, the treatments must be tailored to each type. For example, blood thinners can help with ischemic strokes but would be dangerous in hemorrhagic strokes. That's why doctors rely on brain scans like CT or MRI to quickly determine which type of stroke has occurred. Making the right diagnosis is critical. Giving the wrong treatment can make things worse and even be life-threatening. There's also a condition called a mini-stroke, or transient ischemic attack, TIA for short. In a TIA, the symptoms are similar to a stroke but last only a few minutes or hours and then go away. However, a TIA is a serious warning sign that a major stroke could happen soon. If you or someone you know experiences sudden stroke-like symptoms, even if they disappear quickly, it's vital to seek medical help immediately. A TIA is a warning. Don't ignore it. Fast action and accurate diagnosis can save lives, reduce the risk of permanent brain damage, and help prevent future strokes. Recognizing the signs and understanding the differences between stroke types is the first step toward better outcomes. Spotting a stroke quickly is crucial. Remember the acronym FAST, F face drooping, ask for a smile. Is one side uneven? A. Arm weakness. Can both arms be raised? Does one drift down? S. Speech difficulty. Is speech slurred or hard to understand? T. Time to call emergency services immediately. Don't wait for symptoms to improve. Call for help right away. Note the time symptoms started. It guides treatment. Other warning signs: sudden severe headache, vision loss, dizziness, confusion. Strokes strike suddenly. Abrupt onset is the key. If you see any of these signs, act fast. Seconds matter. Your quick response can save a life. Some stroke risks, like age, genetics, and family history, can't be changed. But most risk factors are within your control. High blood pressure is the biggest culprit, damaging arteries over time. High cholesterol, diabetes, atrial fibrillation, smoking, poor diet, inactivity, and heavy drinking all raise your risk. The more risk factors you have, the higher your chance of stroke. The good news, these are modifiable. Healthy choices make a real difference. Managing blood pressure, cholesterol, and blood sugar protects your brain. Prevention starts with understanding and acting on your personal risk. If you suspect a stroke, act immediately. Call emergency services. Don't drive the person yourself. Paramedics can start treatment en route and alert the hospital. Note the exact time symptoms began. This is vital for doctors. Keep the person calm and lying on their side with their head slightly raised. Don't give food, drink, or medication. Swallowing may be impaired, and only doctors can decide on treatment. Share all information with emergency responders: symptoms, timing, medical history, and medications. Your job isn't to treat, but to get help fast. Every minute saved increases the chance of recovery. Stay calm, act quickly, and communicate clearly. Your actions can make the difference between life and death. At the hospital, the first step is a brain scan to determine the stroke type. Ischemic strokes are treated with clot-busting drugs like TPA, effective only within a few hours of symptom onset. Some patients may need a mechanical thrombectomy to remove large clots. Hemorrhagic strokes require stopping the bleeding, sometimes with medication, sometimes with surgery. Quick, accurate diagnosis is critical for the right treatment. After emergency care, rehabilitation begins. Physical, occupational, and speech therapy help patients regain independence. The brain can adapt and heal. Rehab maximizes this recovery. Stroke recovery is a journey, but early treatment and therapy make a huge difference. Modern medicine saves lives, but speed is everything. Prevention is the best medicine. Up to 80% of strokes are preventable. Control your blood pressure, cholesterol, and blood sugar with regular checkups and healthy habits. Eat a diet rich in fruits, vegetables, whole grains, and lean proteins. Limit salt, saturated fat, and processed foods. Exercise regularly. Aim for 150 minutes of moderate activity each week. Quit smoking and limit alcohol. Small, consistent changes add up. Start with one healthy habit at a time. Prevention isn't about restriction, It's about investing in your future. Take charge of your health and protect your brain. The choices you make today can prevent a stroke tomorrow. Empower yourself and your loved ones with knowledge and action. Let's meet Sarah, a healthy 45-year-old mum who loves spending time with her family. She's active, enjoys cooking, and rarely misses her kids' soccer games. Life seems perfectly ordinary, until one morning changes everything. As Sarah reaches for her morning coffee, she suddenly feels a strange numbness in her left hand. Confused, she tries to grip her glass, but her fingers won't cooperate. The glass slips, shattering on the kitchen floor. She's startled and unsure what's happening. Her husband, Mark, rushes in and immediately notices something is wrong. Sarah's face is drooping on one side, and when she tries to speak, her words come out slurred and hard to understand. Mark's heart races as he realizes these are not just random symptoms. Remembering the fast signs, face drooping, arm weakness, speech difficulty, and time to call emergency services, Mark acts without hesitation. He dials 911, tells the dispatcher what's happening, and notes the exact time the symptoms began, knowing every minute counts. Paramedics arrive within minutes, quickly assessing Sarah and rushing her to the nearest stroke center. Thanks to Mark's quick thinking, Sarah is at the hospital just 30 minutes after her symptoms started, giving her the best possible chance for recovery. At the hospital, doctors perform a CT scan, which confirms Sarah is having an ischemic stroke caused by a blood clot blocking blood flow to her brain. The medical team moves swiftly, knowing that early treatment is crucial. Because Sarah arrived so quickly, doctors are able to give her TPA, a powerful clot-busting medication. Within an hour, her symptoms begin to improve. The relief on her family's faces is unmistakable as hope returns. Sarah's journey doesn't end there. She spends weeks working with physical therapists, relearning how to move and speak. Recovery is challenging, but with determination and support, she makes remarkable progress and regains her independence. Mark's quick action and knowledge of stroke signs made all the difference. His decision to act fast gave Sarah a second chance at life, and their family is forever grateful. Stroke can strike anyone, anytime, even those who seem healthy. But with awareness and rapid response, what could be a tragedy can become a story of hope and recovery. Learn the signs, act fast, and you could save a life, maybe even someone you love. If you found this video helpful, don't forget to subscribe to OnyekaGOD-TV channel. Like this video, leave a comment below, and share it with your friends and family. Together we can spread awareness and save lives. Thanks for watching.